Good morning, everyone. We are grateful to have Dr. Anamika Biswas join us for a Climate Asia masterclass on working in the intersectionality of gender, health, and climate change. Dr. Anamika Biswas has 30 years of experience in technology, tangible and intangible heritage, research, international collaboration, and policy making. She has worked at the Ministry of Culture of the Government of India as a director, deputy director at SAC Cultural Center, Colombo, heading research at NIIT and currently working at the Faculty of Sustainability Studies at MIT World Peace University as their head. Thank you, Dr. Anamika, for joining us.
Thank you, Preetha, for such a detailed introduction. So good morning to all of you. And as you have heard my introduction, you know that sustainability has been part of my life as not the core of my life. So my professional learnings are also, yes, I have been understanding and doing SDGs, and SDGs are also defined and refined, in recent past. So my master class is primarily for people like me who are, trying to come to SDGs, trying to understand sustainability and trying to bring the sustainability in their life. So I'm going to talk about sustainability development goals from the perspective of, first, I would like to say that the topic I have chosen, intersectionality and climate change and health under the SDGs. The idea behind is, taking different SDG, goals, the sustainable development goals, and then trying to link them. When you look at sustainability as in climate, it needs or it requires understanding of and participation of one and all. But when you talk about health, then it is, it comes to human being entirely, just the human being. We are talking about the health of human being. And then comes the sexuality. So these three, the connection between them, I have understood is that, of course, there is a gender bias across the globe. And that is impacting the sustainable development or the development of human race as such community. So that is prevalent in all societies in some or the other form. Could it be, I would not say the gender equality is only for the, women gender, female gender, it is different. But yes, of course, in some of the communities across the globe, it works vis-a-vis as well. So the privileges are, here and there, could be to the male more, could be the female more. So when we do SDG, especially means after definition or, propagating and defining this sustainability development goal, one thing is very clear and evident, that the whole global resources, access and community is opened up. So this interaction, what I just spoke about, that the gender differences or discriminations, they are now, one can understand from the global perspective, which is, as I mentioned, that it is not necessarily that the female gender is being not, her requirements are not being addressed appropriately or equally. One is that. Secondly is that when we have started talking about gender discrimination and gender understanding, so there is, the very unpopular, which has remained gender, the third gender has not been addressed at all. So I think I felt this is one of the platform where I can talk about this third gender and, talk about the equality for the third gender. So this platform, I'm going to use it for that, because we are listening and we are getting to know biologically, due to biological reason, due to, psychological reason, due to other, various reason. There is a third gender which does exist, and it is not being even, accepted or acknowledged. Acceptance comes later, but the acknowledgement is not there. So as a community, this third gender, if it is not being addressed, its requirements are not addressed, I do not think that we will be able to address or achieve or, even have a complete vision of the health for everyone. That SDG will not be fulfilled. So that's how I connected this, health, intersexuality, and coming to the climate. Climate, of course, it affects everyone, but if you go through the data and, all the report submitted. So you would see that when the women, especially female who are working on ground, they are impacted by the climate diversity more than the men. Reason being possibly the biologically or the physically, women have to go through a lot, which is, starting her puberty to menstrual cycle, to, bearing a child, nursing a child, and that possibly makes a requirement much more deeper and, higher than a male, male person. So this also, so that's how the gender and climate is very clearly related. That is, these studies are, right now available. So this was the whole idea when I started looking at masterclass, that how do we do that. But in between, eventually, when I was preparing for this, I got to see that the report has arrived. The SDG 2022 report has arrived, which is giving us indications and a kind of picture that what has been done in last 1 year or 2 years. So my a little bit of attention has gone towards that side. That I think that is more important as a preliminary class or the first class for the master class. I can take you through the this report which is generated by UN, and it is available. So I can just talk about the highlights of the reports, what has happened in the last 2 years. I would say 2 years, it says it's a 1 year report, but of course the impact of 2020 COVID-19 has not left us without any impression. So I see it as, rather report for 2 years. The report started compiling in 2022, 2022 May. They have started, compiling and, writing it down for the sake of publishing. So I'm going to share a little bit about that. And I would like to share, 2 of the best practices. So that's how I have divided my presentation or the masterclass. One that I have talked about very simply, that why gender and climate and intersexuality, how they are correlated. That is one. Second is I will be mainly talking about today the report 2022 of SDGs. And I'll be talking about 2 of the best practices which has impacted, these areas, which is, gender equality or health in a bigger manner, and the climate, which are again published by SDG, the UN only. So this is how I've divided my presentation. I want to share my screen. So I will be opening this floor for questioning later on. I'll go through this bit of my presentation first. Okay, so the very basic, or the as a masterclass beginning, I would like to say state that set by United Nations in 2015, we have 17 interlinked global goals, and these goals are designed in a manner. It's very interesting when you when I start working for one. Means this is what I look at it. When I start working on one, say poverty, it eventually leads me to education. It eventually leads me to good health. It eventually leads to me a decent work, economic growth. So they are interlinked in any way. You pick up any of this, whether it's a zero hunger, whether it's industry innovation, any of these, they are so much interlinked and interdependent. Yet somehow to give a visibility or creating a kind of a blueprint for us, I think UN has done a wonderful job by dividing them into 17 goals. But I would say they are the I think they are the 16 goals, because 17th is the wholesome, or the achieving our goal post, that is peace, justice, and strong institutions. So peace, justice, and strong institution for one and all. If we go through all these goals, no poverty, zero hunger, good health, quality education, and so on and so forth. Eventually, what we want a peaceful community which has justice and has strong institutions which are able to implement them again and again in a better and much better every time in an improved manner. So when I start, learning, teaching, or practicing these goals, so that is what I look at it, or it comes to me that, the end goal is peace, justice, and strong institution, via any of these, or via interlinked these goals, good health or industry, as I mentioned, any of these. So this is, as I mentioned, that I want to talk about the broad overview of the report, and I'll talk about that how these are, three of them are. Can I share some best practices? I think I'll be, yes. So this is the broad overview, and this broad overview is quite disheartening because of many reasons, as mentioned, in the report, that we have faced. One of the very major reason is right now what we talk. The most apparent one is the Ukraine and Russia war, which has delayed, and it has become a major issue in achieving or even thinking about these goals. Second is, due to this war, and as well as the pandemic which happened in 2019, has already dragged back our economies. So that's why we are not able to look at or plan for these goals as SDGs. So it's like very much interrelated when I talk about it, that first we need to have plan, then we need to have budget, then we need to have implementation, then we need to have proper monitoring, and then the assessment and the evaluation. If we are talking about any of our goals, even in the life year, we are having these kind of any goal we want to have, achieving anything, especially when we are talking about SDGs, which are very vast and interrelated, interlinked and interdependent. So there we require a multi approach, and multi perspective connection and planning, and funding to reach or to achieve these goals. But looking at this chart, it shows most of them SDGs. Look at these indicators like SDG, this is with the green, if it is shows that is achieved, and then is on track, green one, green arrow is green, circular point is we have achieved it. And when we look at the arrow, we say we are on track, and we say when we see the same red circle, that means major challenge remains. Red arrow going down, it is decreasing, and yellow is challenge remains, and a little slanted arrow which says moderately increasing, and then is significantly challenge remains, which is the orange one, and the stagnating is, which is a straight horizontal arrow. So given this, we can hardly see much of green circles, which is SDG achieved. Fortunately, we see one responsible consumption and production, number 12, this thing which is achieved SDG achieved in East and South Asia, which as per the data it says that we have achieved. But here, when I wanted to talk about my 3 SDGs, I'm focusing on those, that is good health and well-being. So looking at that, if we go through this sheet, the broad overview, it doesn't show green anywhere in East and Southeast Asia, or even in the Europe. Across the globe, it doesn't show anywhere that we have achieved, or we have significantly achieved. This area remains absolutely without any green, the health. And could it be the reason, the major reason? We can always we have experienced it. So the reason and cause is COVID-19, and that has possibly, instead making it achievable, it has made us more difficult to achieve. So when I'm talking about this broad overview, I'm also giving you the reasons as defined or identified by the UN. So UN has also identified this COVID-19 as one of the major reason for this good health and well-being. The SDG number 3 has not been achieved. Because COVID-19 has not only taken away lives of many, it has also left many countries without properly skilled or enough skilled manpower. Medical facilities were lesser. So all those things which you look at it as reasons has led to this kind of a result, that 2021, I would say 2020 and 2021, the results has shown not that promising. Here we can just simply say the COVID-19 is one of the major challenge which has not let us to achieve this, good health and well-being. By now, after even having the vaccine being innovated and experimented, and we all are vaccinated, yet there are a lot of side effects, or the later effects are coming up. We didn't have the time to examine the side effects because it was such a condition to overcome the pandemic. So all those reasons are identified and acknowledged by UN for this particular SDG, that having these reasons, it doesn't seem so we are going to achieve this SDG pretty soon. 2030 is not that far, and yet with these kind of burdens or issues, a lot of things needs to be planned, looked into, reviewed, revalidated, and then we can look for achieving this particular SDG. Gender equality also, we do not see any green in this. That's again very disheartening to look at this, that we have not achieved any in any country or any geography. We have not reached any the SDG, this particular SDG. So for this, we would not like to claim COVID-19 as one of the reason or the cause. But of course, the reason being that in most of these countries, which I'll be talking about, the planning or the pledging by the government is not there. So very, very few countries have actually pledged that. I will be taking you through that also. Somewhere means it, I'll be talking about how SDGs are to be or are accepted to be implemented or recommended by UN to be implemented in the countries. See, these are the goals which are defined by UN, but they are not mandatory for governments to implement as their policies or their standards or into the budgets. So this is a kind of a welfare guidelines for the community, for the global community, that what has been seen at. But as far as a goal, SDG, when we talk about we are pledging this particular money or this much of resources to these SDGs, quite a lot of countries they have agreed to the SDGs, but they have not implemented them. And when I'm saying that not implemented them, I am going by the report. What report says that they have never taken it as a central policy or local policy to implement these SDGs. So a formal communication or a formal pledging of funds, formal pledging of creating certain kind of bodies or certain kind of statutes has not come from many of the countries. So I see this particular SDG is possibly in need of that kind of a lot of support from the government agencies to pledge some money, to pledge some kind of formulate some kind of policies and formulate some kind of maybe develop some kind of a program, awareness program, or implement further programs to enhance this or to reach this particular SDG. If you look at the climate action, it at least gives a clear two green signs, and it means there are even the low income countries, when we see here that the low income countries also have achieved the SDGs. Apart from that, we also see that the Oceania and what we call that area is also is going towards the green or the SDG has been achieved. But yet most of the countries, they are still in yellow or orange area, which is either it is the challenges there or they are still trying to figure out what to do, how to do. But yes, comparatively, if I see these three SDGs, so the worst is currently health due to COVID, of course. The second is gender equality, and climate action looks to be a winner here. People have worked towards that. The whole community, global community has worked towards that. Regarding this climate action, I would also like to say that climate remained a talk, a kind of a cause from almost 30 to 35 years. Could that be the reason that the globally people are accepting this as a challenge, and they have been working on it from last 30, 35 years? So the impact, whatever we are seeing here on this, report is not necessarily which is after, declaring these SDGs. It could be, the impact of prior to that also, that it is a continuous process, and we are able to achieve this in a little better manner than the others. This is, sustain. This is country-wise. I have, though we have 195 countries which have been listed there, I have chosen, some of them, and they are in alphabetical order. So there is no preference as such. I have picked up the one, first sheet to just go through it and say that how some of the countries are doing in these three SDGs. Health again, if we look at it, it's all red. Means starting from Bangladesh till Vietnam, Singapore is showing yellow, which is possible. They have done a lot of strict, very very strict policies during the COVID pandemic, and they simply closed down. And that is the one reason possibly that they are showing a challenge remains there and not showing that there is a major challenge remains there. Um, uh, most of the countries which have closed down, if you look at it, like even China, it has closed down during the pandemic. So they are showing this kind of a situation where the challenge remains, yet rest of them all are showing that it is a major challenge area for all the countries, starting from Bangladesh, Bhutan, Cambodia, China, India, Indonesia, Malaysia, Maldives. So you can read any of the name and it's just, red. It's almost, it is the whole, row shows a red mark, and it is very, threatening, or rather, it needs a lot of attention from government agencies, the central government agencies, NGOs, and all the, public partnership models that we have to look into the health sector. Now, when I'm talking about this SDGs, this also brings into picture that when we are reviewing this report, it is telling us that next 20 years, which are the areas we need skilled workforce. The requirement of the employability or the kind of workforce we will be having soon, that is very clearly visible here. So in the last table and this table, you can definitely match up that the health sector requires a lot of workforce, requires a lot of funding, requires a lot of maybe innovation, a lot of new ways to tackle this problem or achieve this particular SDG. So that is, I again, I mean, there were many reasons when I took health as, good health and well-being, because that is the core. If the community is not healthy, they cannot think or they cannot do anything. Forget about anything doing innovative. They can't do their mundane job. So that's why that was another reason that I have chosen this health as the SDG 3 as one of my core to start with. So looking at this, this should be going by the report. SDG 3 should be the core from where all governments should start looking into or redefining their policies and, priorities for achieving, prosperity and peace. Then coming to the gender equality, because it is directly related with the health. So it also shows significant, red dots, and a bit of oranges are there. But yes, this also doesn't show that much of hope. There is no green again. So that also requires a lot of improvement, a lot of policy changes, as we know that as I was talking about the intersectionality or the third gender. When I'm talking about gender equality, my emphasis here is for the third gender, that the third gender needs to be has to be acknowledged, needs the policies and programs needs to be focused on the third gender. That's very important right now. So I think we should be as a policymakers or people working in the development sector, we should be now talking about gender equality between not 1 and 2, gender number 1 and 2, but should be between 1, 2, 3 and all genders. So that remains one of my key points whenever I'm talking about gender equality here. Then comes to the climate action. Again, I may say that we are fortunately we are doing good with the climate action due to, as I mentioned, one was I mentioned that there's 35 years that climate has been a reason that or the cause many of the countries are working, many of the NGOs are working, many of the intellectual lobbies are working. At the same time, COVID has worked as one of the beneficial factor for climate. Everybody knows that the global community stopped and the transportation stopped, whether it is air, whether it is road. So that has also added to the climate change. So why I'm saying so, the policies, when we look at this report, when I was reading this report and trying to even collect my own thoughts and collect my own learnings of last 2 years, so I realized that whether how much the agencies have formally worked, or they have achieved this climate this SDG number 13 due to their work or their actions, that remains, that might be partly there. But I think COVID has done a good job by stopping everyone and sit back and lockdown, and that is where the climate or this SDG number 13 has been seen into more greens. So not only that the air traffics were closed, not only the road traffic was completely locked down, even the ports were closed. So it has given a breather to all surfaces, or all types of lives to breathe properly and revive and revisit themselves. So I think that's where the climate action SDG seems to have SDG 13 seems to have got a lot of greens. Again, interestingly, the COVID has given a lot of reds in the health area, and same the result of the same cause in climate action is showing a lot of greens. So this is this is what actually changed my whole mind when I was preparing for this master class, that I think we should need to look at this report and understand that what are the factors, or maybe the causes which are going to impact SDGs. Not sometimes in a planned manner, sometimes in very abrupt manner. We might be able to achieve some of these SDGs. So here the SDG 13 shows that kind of development, or kind of a clear picture that abruptly COVID-19, or without any good intention, COVID-19 has actually made us to achieve climate action SDG number 13. So I wanted to show in India what is happening there, and then again India, gender, all are red, and climate action, it is green. So again, the same reasons go for all these things. For India, I'm going to speak about it because what I read in the report, it says that India has not created any central policy towards SDGs. It has not pledged any allocated any budget towards the SDGs. So we might have worked within our own policies, the existing policies, that we wanted to achieve these SDGs, but the SDGs as a core, or as the goalpost, has not been indicated in the government policies and the government budgets. So that is a very important and crucial point. That's why you will see that India looks pretty red all across. So again, this is the report where it shows that how national governments have responded to SDGs. So very nicely, the headers are given, and you can go through that. That high-level statements, India has some of the countries, when you see that they have, given the high-level statements, what they will be doing, and accordingly how they are planning to do it. Then they have gone ahead and they have created a sectoral plan, and then there is a national budget. It's a very systematic way. I think the report has created this particular table, when it says that high-level statements from the central government has come in some of the countries. Then based on the high-level statements, the strategies have been created and implemented. Then is the national budget, whether it is within the overreaching narratives of the government, or section-wise budget line was created for them, and then the monitoring is done or not, and designated units have been established or not, and what is the status of SDGs at the national level during pandemic. And so one can go through this, and I'm again, coming down straight to India, and India has not done as such, any of these things. There was no high-level statement, there was no SDG strategy, no sectoral plan, and so when this is not there, so you cannot have budget, you cannot have bodies or monitoring or any other things. But of course, I would request you all that please kindly go through this report and see that the status of these particular countries where the governments have pledged their money, they have created high-level statements, and then they have created sectoral sectoral plans, also action plans, and then the monitoring has been done. The results are really great. So that is definitely there. A country like Cambodia has done very well. So I have not marked it here, but the Cambodia, if you just look at in the this thing label in the report, you will come to know that it's not a developed nation yet. They are working towards it very systematically. So they are having high level statements. They are doing sectoral plans. They are having budgets. They are doing monitoring. So they are doing pretty well in this SDG. How they are achieving most of the SDG. They are. I'm not saying they have achieved it, but they are improving. And I have chosen Saudi Arabia, and there are also countries. I have shown one of the country, India, which has not done anything. Then there is country which is like Cambodia. They have completely devoted themselves and they are following this SDGs. And there are countries which have mixed reaction or mixed kind of method to achieve these SDGs. They are trying to do that. So Saudi Arabia is one of the countries. They do not have a high level statement, but they have SDG strategies they have put in place as per the sectoral plan. This is another way of reaching SDGs. Then they are talking about the national budget is not there, and yet they are doing the monitoring. Possibly when we are talking about national budget, we are talking about the money from the government side, but since there is a sectoral narrative is there, plan is there. So could it be the PPP partnership, public-private partnership is working towards that, or NGOs are working towards that? So not the government money is directly going for these particular aims, yet some kind of funding is going on. So one can see that there is an impact. So depending upon, this mixed method or strategy, every country has responded to these SDGs. So highlights when I went through this report. So the first highlights is that peace, diplomacy, and international cooperation are fundamental conditions for the world to progress on SDGs. And when this highlight is discussed, the first thing we are talking about, I think it has been doubly copied. Sorry. So the very first issue has been raised as Russia and Ukraine. So we are talking about international borders. We are talking about wars happening, and Ukraine war is impacting now. By now, it is impacting the whole Europe. So the inflation is going high. The gas prices the energy prices are making it difficult to control the inflation. So which is going to in turn, which is going to impact everything, whether it is the health sector, whether it is employability or overall community development. So the first point is about that. Can we have peace? Can we have better visionaries to lead the countries, so we do not get into these kind of peace, this kind of wars, and we maintain the peace. So that is one major war going on, and we are witnessing that. It's very unfortunate. Just after such a pandemic, the leaders of such statures have decided to go ahead with the war. That is pretty unwanted and uncalled for. At the same time, there are other threats which are not necessarily that we have boundary or the geographical countrywide issues. We do have regional within the countries also. There are situations which are related to unrest or civil civil unrest is also there. So the main criteria or the main issue, if we sort out the peace, if we can bring in, so we can start looking towards SDGs. Or in simple words, we cannot plan or think or bring our funding towards SDGs unless we have basic peace. So that remains very, very important a highlight of a UN report. It is talking about it, that the peace is very, very fundamental to begin to sit and think about for future. And then it is saying that at midpoint on the way of 2030 policy efforts and commitments supporting the SDGs very significantly. Now, as I mentioned, that those 3 charts which I have taken you through, that they were primarily about it, that the policy and efforts and commitment towards the SDGs, they are not showing significant significant commitment or significant work towards it. Very simply, if you do not have a central level or a national level policy, the budget will not be diverted towards it. But at the same time, we do see at Saudi Arabia, they are not having a central level policy, yet they have diverted some budgets, or not the government budgets, but the other funding is working towards it. So if you look at the whole chart of 194 countries, and they don't seem to have a uniform pattern or method towards these SDGs to be achieved, which calls for really sitting together and thinking about it, what have gone wrong, or what has been the best practice to go ahead and achieve these SDGs. The other point, which is very disturbing, is that rich countries, they have high income group, and they are having resources, and because of them, the spillovers are coming to the countries which are not that third world countries, or maybe the underdeveloped countries. So be it their emissions, their carbon emissions, or their food supplies, or whether even the food supplies are creating a lot of disruption in the underdeveloped countries. So the rich countries are the report says rich countries are rather creating a lot of negative international spillover. So whereas it is expected from the rich countries to generate positive spillovers, or benefits to the countries which are in need, or which needs the help. So this is a very, very negative factor, which is very prominently discussed in the report, that rich countries, instead of supporting or providing funding, or maybe providing innovative or technological help, they are well focused towards their own consumption, that that it is leading to negative international spillover for especially the smaller countries, or the smaller countries or underdeveloped countries. And anyway, the COVID-19 data, everybody knows, has anyway pulled down every sector due to the lockdowns. But interestingly, as UN always look towards the best or the better part of every impact. So they have rather talked about in their report is how COVID-19 has created a lot of innovative platforms and a new kind of partnerships, which has created provided SDG some kind of impetus towards achieving it. One, the climate I discussed, but innovation and community life has seems to have become better as per the report, because of the kind of networking, or the innovative IT, or our internet, or the platforms has been created. It has also provided better data storage. It has also provided COVID-19 had also provided or asked people to think and innovate secure databases, or better data sharing that has also come up due to the COVID-19. So these are the highlights which have come through this COVID-19 SDGs 2022 report. These are some of the grand, recommendations which has come across from UN. Very first means, if I have to say that it's very important, the funding is very important for SDGs. First, I would say that the one I mentioned in the earlier, the major problem or the major issue that SDGs are not being achieved is that at the policy level, the governments are not that sensitive or not responsive enough. So first and foremost would be that government has to respond in tangible manner. So there has to be a tangible statement, tangible goal post that we all as a nation we need to look forward. That is the very first, recommendation I think should go in for that. This is from the UN, but I'm talking about what I understood and what I felt is missing. And if it is missing, then we cannot achieve, we cannot, go about or think about budgeting and all that. So in my understanding, the first should be that we need to have that, goalpost being declared and being, we are completely committed to that. We need to pledge for that as a nation, as a community. We need to pledge for that. That is the first one. Second is, we are talking about if the we have created this policy, or we have come out with the pledging towards these goals, we need to have funds for that. So this is primarily, when we look at it, it talks about, UN talks about a lot about the funding. So they are talking about that funding has to be created. The large fundings, they need to be kept aside for these SDGs, and then various methods such as multilateral development banks, they should be and they should be participating and making better policies for these SDGs to be achieved. Third is that G20 should support other measures as well. It is saying that overdraft services, or philanthropic and debts, all should be to bolster the SDG finance. So primarily UN has talked about that most of the time, that how funding can be made available to the SDGs, and that is only possible at a global level, at intergovernmental level, and not only at national level. So first and foremost, which, as I mentioned, that in international level we do have these defined SDGs, but unless the governments chip in and they devote themselves and commit themselves to these SDGs, these steps cannot be are not going to be implemented, or they make no sense. So the first and foremost, the policies has to be in place, and then the funding can be achieved through these multiple manners. Now, these are the recommendations, coming from, again, UN, based on their best practices. They have seen that how the government accountability system works, that it has to have a vision, and it has to have priorities and objectives, then plans and budgets. As I was saying, that vision is very important, then the priorities and objectives are important, then comes the plans, then budget, and then implementation, monitoring, and evaluation and improvement. So this is the basic accountability principle. Here remains the transparency, efficiency, and accountability at the government level. But when we are talking about at intergovernmental level, the whole circle remains the same. The cycle remains the same, the way it has to be conducted or created. But the sustainable development principle will be different. It is intergenerational consideration, system thinking, multi-stakeholder participation, and adaptive management. Now, this has to be, when I'm talking about that, government or the national or the central government has to come and decide, or pledge themselves for this SDGs. So this is the change we are expecting, or we need to look for. That beyond this just basic transparency, efficiency, accountability, they have to grow beyond it, and they have to think about intergenerational consideration. They have to think about system thinkings, how the systems can be changed or manipulated. Multi-stakeholder participation has to be brought in, and the adaptive management. We cannot go ahead with the set rules and set managements, that these are the areas, and we will not be changing or moving out of those. So these are the very and this the recommendation which I'm sharing with you right now is not based on this 1 year of reporting. This is based on last 15 years or 16 years of whole research which I've been going through, that how what are the principle, and how we need to look at sustainable development goals, or as a global community, as a development, what we should be changing or what we should be doing. So these recommendations are based on learning from almost a decade or plus. So the change in the government accountability system has to be there. These are, some of the best practices during last 2 years, which have been mentioned or worth mentioning by the UN, which I would like to share. There is one, the postgraduate fellowship, migrant and refugee health. This is, and I have chosen very specifically from an underdeveloped country, Bangladesh, which not only faces crunches of finances, is also most highly populated density, density wise country. Also, it is facing many other issues which are related to boundaries, people crossing boundaries, the civil rights, all these things are there. So if you look at this particular country like Bangladesh, This is going through a lot of changes. It requires a lot of development, but yes, of course, they have chosen to divert their policy towards certain SDGs. So this particular program, which they have created, postgraduate fellowship in migrant and refugee health, is very well accepted, has come out with wonderful results also. So this is a program where they have started in 2018 to upskill their medical professionals. When it was identified and it was planned and jotted down, that point of time, you can see 1st January to 2018, we see the implementation period. The COVID was not in the picture, but within a year, COVID was very much there, and the COVID has also added a lot of parameters and changes which was brought into this program. So the one reason or the cause this fellowship or the upskilling of medical professional was required because of the Rohingya refugee health. That was the major issue, and they have looked into this particular issue, that how to settle this Rohingya refugees positively, peacefully. Since they were coming from other country, from a very a bad situation, a refugee never comes with a happy, because he's happy or he was just traveling around, but they lose their whole everything. They have lost their properties, they have lost their families, they have lost their, they're displaced. Simply, that is what the definition of refugee. So having said so, health doesn't come as a picture. That's the time the survival is the cause. They are running towards a place which is going to, or a boundary which will accept them. So having this situation, the medical professionals were retrained or upskilled to understand the mental health, the physical health, taking care of both the genders. I'm very specifically saying both the genders because as far as I read the report, it doesn't talk about the third gender. So they have taken care of both the genders. Specifically for the females, they have created certain specific health related programs. So the awareness was there. So not only the basic medical training, but added training towards the what are the parameters, specific parameters which where the refugees would require or the migrant would require health support was created. There were 26 modules were created, and then almost a lakh medicals and paramedical were 26,000, sorry, paramedicals and medical staff was trained on that, and the impact was seen quite good. And that module is now known as one of the best practice. Just knowing the medical or MBBS or the medical profession or their technology and technique and learning is not enough, but yes, the mindset for the patient, the whole context of the patient as holistic health has been made the main premise for the modules and learnings, and so the results are phenomenal. So this is one of the best practice, and UN is trying to would like to share it as best practice, would like to scale it up, and also like to replicate. Now, when we are talking here about the Rohingya refugees, now at the same time we are having Ukraine, Europe being flooded with the refugees from the Ukraine. So that was the other reason that I have picked up this particular case study. So this program or this best practice can also be replicated now into the European region for the Ukraine, refugees and migrants. So this is one of the learning I wanted to share for people who are into this development sector. So you guys can look into this particular case study and see that how you can create certain programs which can help if you're in European region, or even if you're in the Asian region, how this case study can help you out. And this is a replicable model, and it is scalable model. Another one which I've taken, it is primarily on the goal number 13, climate action. It is very simple, and it is going from February 1st, 2016, Mediterranean cleanup. This is a best practice, and of course it is scalable, and it is being replicated quite across, and it covers many SDGs. It is number 8, number 4, number 12, number 13, and 14. This is about taking traditional learnings, compiling traditional learnings of Mediterranean fisheries or the fishermen, and then adding with them, or giving them understanding about the climate and the impact of climate on their practices. So what they have done is through their traditional way of fisheries, it was found that they are able to collect a lot of plastic which has been disposed into the sea, that used to come along with the fish and their whatever they're collecting for their professional purposes, financial purposes. So segregating this waste from the fish and the livestock, that has been one of the module for them. And also the further upskilling these fishermen or their communities for recycling and upcycling this plastic has been added, and in turns it is a circular economy has been created at this Mediterranean and Greece and Italy, these two countries. When I'm saying the circular economy, I mean to say that prior to this, not only they were taking out this plastic waste from the ocean or the sea, but also they were adding to it, because when their nets or other materials, root tools are redundant and they are of no use, they are torn and they have become not unusable, they used to throw into the sea. So that learning has been given to them, and that they are not supposed to throw it there, and how to recycle them, upcycle them, and create new products out of them. So that's how the whole a circular economy has been established, instead of throwing it into and making this sea into a larger waste bin, to cleaning it by the same fisherman who was adding waste into the sea. The same fisherman is catalyst for cleaning the sea, and also is able to generate income through that waste which he is collecting. This, I think I have already talked about it. So this is what I wanted to speak. I believe this means one can talk about SDGs for hours and hours, but my time is over. I think at 11:45 was the time I should have closed my talk. I have taken 10 minutes extra. So I think I'm now opening the floor for questioning. If you can ask, if you want to ask, you can ask any question. Thank you. Hi, Preetha,
Thank
you
you,
can.
Dr.
Yeah,
Anamika.
yeah.
Yes. So I would love if anybody, it would be great if people would put their questions on the chat, or even speak, unmute themselves and speak. That would also be very helpful.
I think one question has come: what performance variables or key performance indicators should companies and other social sector stakeholders look into while measuring the output of their SDG-oriented social projects? I will give a very simple and basic answer to that. RK, I don't know, RK, I'm just addressing you as RK. See, the SDGs, if you look at the core of the SDGs, they are Ruchika Kumar. Thank you, Ruchika, for asking such a wonderful question, because, SDGs, when we look at it, we should not be looking at as, kya hona chahiye, what should be here. But the SDGs are meant for holistic development of community, which should also include our whole gamut of the environment, whether it is the smallest of the species. So when you're talking about SDGs, that what are the parameters or variables we should be looking towards. So for example, when I gave you this case study for Mediterranean Sea, so it depends on the sector or the organization where they are working, which condition they are working. If they're working in a fishery area or aquatic area, so their universe is that coastal line. So how they can make this coastal line livable, not for themselves but for the future generation, those are the parameters they are supposed to add into that. So what are the ways they are going to create awareness in the community that this coastal or the fishery or the professions they are doing, they become agnostic to timeline, agnostic to technology. So this could be the one of them. How can they become agnostic towards towards age, agnostic towards gender? So these are the primary key factors when you are creating or trying to achieve any of the SDG. So so whether it is health, whether it is age, senior citizens, whether it is the child labor, or these are the, when you look at the SDGs, they actually you convert them into the variables, they are the variables. You convert them into the goals, they are the goals. So if you're taking any goal, rest of them are the variables. You just check it and create this table. You will be able to come to the conclusion that what I'm saying is the format you should be creating. I hope you got this one, Ruchika. How do you see the sink in net zero commitments and groundwork happening towards achieving that goal across the globe? Which are the countries where the progress is the most satisfying? Again, I think this is from Sumesh Mananji. Sir, I am not an expert in the net zero, and I'm overall working on the, learning, rather, not working, learning about the SDGs, and I'm trying to bring my perspective there. Yes, net zero. If you look at most of the countries which are creating energy, are the one who are creating the maximum, carbon. So, and then is the first is when you create energy, you create a lot of CO2. Then when you consume energy, then you create a lot of CO2. So these are the countries, you just map which are the countries who are doing these two things, and they are the topmost who are adding CO2 and a major issue for our net zero. Of course, US been known for that because the consumption of energy is much higher than any other country. So that's where it is. Which are the countries where the progress is most satisfying? Energy sector, I have not gone through the report in detail, so I cannot be able to make any comment on that, sir. Thoughts on the role of culture in achieving SDGs? Ankur, culture is, when you look at culture, it is very, it's as important as life. So culture is very, very important in achieving the SDGs, because culture involves or encompasses everything. What I'm talking to you, how I'm talking to you, what I'm wearing, what I'm eating, where I'm living, what kind of furniture I'm using, what kind of energy I'm using, what I'm, what kind of grains I'm, eating. Am I eating non-vegetarian, vegetarian? What kind of cereals I'm eating? All this is culture. And if we can create set parameters for, as I said, it has to be community or sector oriented. We can have certain parameters and can be followed by the communities. SDGs, it's not difficult to achieve SDGs. I don't want to make a very flat or straight statement about it, because somebody asked me another question related to that, as I will come to that. So generally, the traditional knowledge or the traditional way of life was less of pollution creating, or less of harming nature. Most of the traditional communities or the culture have been respectful towards the nature. It means if you read any of the, if you ask any of the old mythologies or the stories which are 2 generation back, people were listening and following, they were about nature, they were respecting nature, they were respecting trees, not to cut them, or cut them in a certain season only, when they are flowering and fruiting, not when they are actually sprouting. So all that, if we have followed, then we can definitely have better achieving of the SDGs. At the same time, somebody asked me, being in the forum and with people like you, somebody asked me this question: if the traditional method or the learnings were so good, how come we have reached here? So so this question also is it's very much part of when we say about the traditional knowledge and traditional living. Of course, the answer to that is because we left the traditional ways and we tried to get into industrialization, and hyper consumerism is the cause that we are here today. Any other questions, sir? Thank you.
Yes, so there are one more question that Dr. Arup has asked, but before that, can we please ask Jay to unmute themselves, because he has raised his hand.
Hello. Yeah, hi ma'am. Jay here. Actually, I just wanted to know about that views on that policy that adopted by UK or US or particular developed country related to the SDG for allocation of budget and to localization of SDGs. in the cities or urban local bodies, how they are planned for that. And second thing, which is connect with that only, which is climate action goals, 13 goal we have. But for the developing country, I'm also working in a climate space only. But sometimes as a developing country, economy is also very important thing to look into it. So is there any particular strategy or something like that, economic oriented climate action plan, where economy is also important to grow GDP as well as that per capita income in the developing country, as well as CO2 reduction is also one of the strategy that we have to follow. So I just wanted to, if you know about any policy where or any reference of that particular views. And also third thing that just wanted to see, I saw one slide that India has showing that no political forums or high level statement till now. But I think in India, Niti Aayog is one of the body who are looking into the SDG, and they have appointed something special secretary to for the SDG, and they have collaborate with the UN also. And each and every state are doing SDG plans to achieve those goals, and also they have developed their own indicators uh, based on their requirement and region requirement.
Okay. So Jay, I will go one by one. First thing, the last question I'm picking up regarding that, you said that my slide is showing that India has not pledged or doesn't have any policy. It is not what the slide is created by me. It is the report which is published by UN. It is right now on UN website. So possibly India is doing something or doing greatly in the area of SDG, but when they have reported it to UN, they have not mentioned it. Okay, so UN cannot pick it up from their government's website and say that they have pledged it. So reporting has to be done. So there is a set way of intergovernmental agencies that they will work. They ask for the information which is validated and certified by the governments, and that has to go into the UN official secretariat, and based on that the reports or the tables are published. So that is why possibly you are not able to see, when I am not able to see that. That is why I was also worried that how it is showing that it is not there. But possibly the Niti Aayog is doing very well on that, and they have not reported it, right? That is the first answer. Second question, you asked about the UK or developed countries, how they are doing the SDGs. So let me tell you that if you go through these some of the UN SDG, there's this particularly SDG website, and you will see there are good practices given. There are many of these programs are given, which are or strategic plans are given, which are scalable, replicable, and all that. So not necessarily that UK has taken a done or created a good strategy. So it's not there. So there are other countries rather, like Bangladesh, like Greece, Italy, African countries are there. They are doing in rural community. They are doing pretty well. So not necessarily that the developed countries are creating good plans. So there are other countries also. Innovation is happening there also. Strategy is being innovated in much better way in other countries also. And it is very much available on the SDG. There is a link called sdg.org. You just start, surfing that. You will get to know best practices are also given there. One of the document when I was studying for the SDGs, I came across that the best practices which have been identified whether any of the countries for implementing SDGs, it is what which I have shared. That recommendation has come out that it is beyond transparency and accountability. It is more about holding hands. It is more about extending the responsibility and accountability to many stakeholders than just to the government and the public. And other entities needs to be acknowledged and made participant in that. So these are some of them. Apart from that, there are both the approach have been found successful, whether it is top to down when they are made some strategies or planning, that the whole planning is done from the top and it is coming down, trickling down to the root level, grassroots level. At the same time, some of the strategies have been found very useful or has done very well, which have been developed and defined by local people, and then they have reached to the national levels. And it is not about any particular geography. So if you read this SDG.org, their best practices, you will get to see multiple such, small nations, they have come out with these kind of strategies. So as I mentioned, the one is the government's commitment. Second is even the community, how it is responding to that. So in the case where the top-down approach is there, definitely government is more active in those geographies. And where the bottom-up approach is there, or the strategies have become best practices, definitely the community is more active towards that. So instead of looking at the strategy planned by whom, it is rather who's more active is, or who's more responding is the right question. Any other question you asked? I think I answered two questions. There was a third question you had regarding the energy, I believe.
Regarding that economic oriented climate action plan, or because developing country
yes, Jay, as I told to Ankur, Ruchika, that when we are planning it and when we are trying to achieve any of the SDGs, and you sit with all the SDGs, and you will realize that they talk with each other. They are interconnected, they are interrelated. For example, I gave you this very simple example of Greece and Italy. You look at India or look at any of the countries, we all have coastlines. So if it is implemented, it is climate action, it is, for better aquatic life, it is better economy. It is, development in their, life products also. What are the products they will be using, the new type of products they can create and they can use. The example I just gave you, one of the best practices happening in Greece and Italy. So they are not separated from each other. I don't think they can be separated. So as each of the goal is very holistic and very much interconnected. If you want to do anything and with the hand in hand keeping the climate action in your mind, it is very much possible. It is not impossible. Rather, it becomes easily possible, achievable the moment you look at 2 or 3 or 1 or 2 SDGs together, and they become part of it. It becomes automatically part of it. Ma'am, what are your thoughts on the role of culture? I have answered. Any other questions?
Yes. So Dr. Arup Saha has asked, could you please highlight the thrust areas on which community-based research can be undertaken, which can later be translated into policy decisions, especially in context of health?
I think, in terms of health, there are, many more or better, traditional or community level practices which have been part of our knowledge system, traditional knowledge system. They need to be identified, whether it is, acupuncture, or it is homeopathy, or it is Ayurvedi, or it is Unani. These are the traditional knowledges which I understand. There were also types of, traditional, games and exercising in different part of the geographies, whether it is, Tai Chi, or whether it is, many of in India also. So these needs to be documented. These needs to be, re-seen and scientifically examined. When we are talking about this traditional knowledge, we should not be harming or putting anybody on the way of harm. So this traditional knowledge needs to be scientifically examined and then put as a strategy. And definitely in most of the cases, when you look at Unani, or when you look at, even Chinese herbs, or you look at Indian herbs, so they are more suitable to the people who are residing nearby the areas of the same geography. Nowadays, the nutritional value also is been told that wherever you stay, wherever you're living within the 20 kilometers, 30 kilometers, maybe 200 kilometers area, whatever is grown and cultivated is the most, or the best cereal or the best vegetable for you. You should not be looking for those, exotic fruits and exotic, vegetables or exotic cereals to remain healthy. So rather, whatever is locally grown, locally cultivated, that is the healthiest thing. So I'm coming to that point is that if we can, for in the health sector, even the midwifery, the knowledge and the practices of the midwives of earlier times, which is missing nowadays, needs to be collected and needs to be scientifically examined and made a training module for many of the communities, because it is much more required. Medical sector is one of the, or the health sector is one of the sector which always is dried off skilled human resource. So I think these are the few areas which I think, if they are researched well, scientifically examined, the traditional knowledge of whatever the medicinal systems we had in any geography, we should be, this is the high time that we should scientifically collect them, research them, document them, examine them, and put them as part of our, medical systems. This question is from Pritha. Okay. Pritha, can you please highlight learning throughout your career journey which led you to passion about gender equality as a thing? There are many learnings. Very first learning is that if you look at India, especially Northern India, if you look at East India, women are very much empowered. If you look at even South India, women are equally empowered. But if you look at Northern India, women are not given equal footage, whether it is be it education, be it opportunity to work, or whatever areas are there. If you see somebody driving a two-wheeler, a bike, Royal Enfield, so people will look back. A girl is driving this, so people will look back even today. So this is a very simple mindset I'm talking about. Even a pilot, or right now somebody has gone as chosen for Air Force as some certain officer level, that becomes a news. So these are very basic things, unexpected, or should have happened naturally. When it was happening for men, for the gender one, male, it should have been happening organically for women also. We need not to ask for it. We need not to publish a news. The Air Force, lieutenant, it's a woman now. Oh, we are having a woman president now. Oh, we are having a woman, prime minister now. That should not have been the case if we have been gender equal. So it's a very, very, vast and bigger vision I am giving you. Rest, when you look at the more and more community and a deeper level, you will find that is more prominent. That becomes very, very prominent, that the women are, or the female are not given opportunity for many other things. So that I have seen throughout. And even now, when you look at the big fours or any of the organization, what is the ratio of women in the top pyramid? It will be, and if there is 10%, they will be publishing it as their best practice. Why do they need to practice? They show it off. That's, a woman is equally intelligent. So that's where my learning is, that so you don't consider them, compare them, or try to differentiate them in anyhow, or highlight them that women are special or not special. They are part of society. They are very much part of society. They are there, so the society is there existing. So give them their fair amount. So this is my learning, and this is a simple vision. You just open up Google and see how many women are there, even in Google or Accenture. You will get to know that, big fours, how they are doing. So it's a clear vision. And my own professional learning also says the same, that wherever I have gone in organization as a leader, men are, I'm sorry to say that it's difficult to establish as a woman, where the, gender biasness comes in. The group will say that, oh, madam has come, like, okay, madam has come, madam knows, so she's there. But there is a if, but, and a way of looking at a woman who's leading, whether it's a government organization, whether it's a private sector, whether it's academic institutes. But if you want to see a boy nurse, then people will say, oh, there's a boy nurse there. So this is a very common practice across the globe. It is not necessarily I'm talking in India. It is across the globe. It is like that.
And Ruchika has asked another question, asking mental wellness and health as part of areas to explore and work upon. What are your thoughts?
Mental health definitely is a very important and very crucial area for a holistic health of any human being, or even any being existing being. चाहे वो अगर आपके रास्ते में if there's a dog or animal who's stressed, you will be afraid to cross the path. So just that's how one has to see that the mental health is very important, very crucial. And what I've been discussing with some of the leaders in mental health, I was asking that how mental health has come to focus in a way. It's a good thing that people are talking about it, people are discussing about it, and we need to understand the requirements and responses towards that. At the same time, I wonder that in some cases, the mental health people means the institutes are I'm happy that institutes are making them as one of the criteria when they are talking or taking psychological tests for people. Time and again, they are doing stress relieving camps and boot camps for their employees. So that's a very good start. So it is beginning to boom. And I see as a future it will be there, because starting from the schools to education institutes as a learner or as a student to the academician who's performing or teaching, and the corporates, they all are enabling and adding such modules quarterly for keeping the mental health in their focus.
Thank you, folks. This has been wonderful, Dr. Biswas. And hearing you, we would love to hear you on other topics as well, but time doesn't permit that. But thank you, folks, for staying on. And if you have any more questions, you're free to connect with Dr. Biswas on LinkedIn, and we'll also, if she permits, then we'll also give her contact details, that is emails. And
yes, Pritham, you can share my email ID. I'll welcome all the questions, and that will open a venue for me also to research and communicate in the sector. Thanks. That's a wonderful suggestion from your end. Thank you, Pritha.
Thank you, Dr. Biswas.